Today we are discussing very important topic of patient care. And when a person is admitted in a hospital, he or she is exposed to some of the pathogens which can harm and which can increase and produce the symptoms of altogether new disease or aggravate the existing situation, and we call healthcare associated infections. These are the germs, particularly bacteria, viruses, fungi, and some other pathogens which when a patient comes for any treatment or for any procedure or visits hospital and is admitted, and within 48 hours can contract or can be infected by these germs. So we call them nosocomial infection, or in common terms healthcare associated infection, or HAI. The most common prevalence or the research shows that out of at least 30 to 40 patients, one patient is infected by such germs, and they enter into the body through various routes. One is the central line where the drugs are given through the drips or through the intravenous route, through the injections. And another is the route where these germs enter is the catheterization, whether it is a urinary tract catheter or some other such type of intervention. And then after operation and surgery, if proper sterilization and precautions are not taken care of, then the wound or the surgical infection can be happening in that patient. Blood stream is another way where these germs can enter into the systemic blood circulation and can cause pneumonia and other blood-borne diseases. Then there are certain orophycal, if the hands are not washed by the serving staff or the proper utensils and the water supply system is not there, then we can have such bacteria as Clostridium difficile, which can cause the severe kind of the diarrhea. So normally these hospital acquired infections are HAI. They cause economic loss of 25 to 31 billion US dollars in the world level, but alone in European countries or EU countries, countries, 7 billion euros or sterling is caused by such infections, and patients, about 16 million extra days of hospitalization is because of the HAI or healthcare associated infections. In one of the study in Mexico, it is mentioned that in a single patient, if these healthcare associated or nosocomial infection occurs, then the cost increases about 12,000 US dollars. And this shows that how much waste can be prevented if proper precautions or healthcare associated infection control or patient safety measures are taken, And for this purpose, the reasons why these infections are increasing worldwide and such economic loss is there. The reasons can be enlisted as understaffing or untrained staff, overcrowding of the patients, absence of guidelines, and proper hand washing and precautions of infection control, whether it is the ventilation as well as sunlight entry and proper linen and other healthcare waste disposal system. So the WHO is concerned about the patient safety, and this problem is a global health and public health problem. So the hospital and healthcare, whether it is a GP's clinic, physicians, small dispensary or small unit of the basic health unit in Pakistan, Talka hospital, district hospital or a tertiary or specialized or super specialized health care. Because of the new technology and other things, the chances of healthcare associated infections are increasing day by day. And in USA, the figure shows that about more than 50,000 patients either they suffer from this infection related morbidity or mortality, and a lot of wastage of life and wastage of resources and economic loss is there. Same is situation in the poor countries or resource poor countries. So how to avoid such infections? We can have a proper infection control committee, infection control officer or manager in every hospital, and our short and training of healthcare workers, refreshers should be an inbuilt or a regular feature of every hospital or healthcare system. So with this, I think we will try to update you about the healthcare associated infection, but two infections, particularly the MRSA, methyl resistant Staphylococcus aureus and other infections are very common, and they are very serious threat to the health and the recovery of the patients. Other important aspects are, because of the pandemic, we should take care that the proper social distance and mask wearing, gloves, and proper donning and doffing of the